Welcome back into ABC7's More in the Morning. Time now for our Healthy Living segment with personal trainer Eric Stratman from CrossFit Eng in Cape Coral. This morning, Eric is getting us a little bit more on HIIT training. Eric, good morning. Yeah, we see the logo right there on your chest. How you doing?
Yeah. Good morning. Good morning. How you guys doing?
Doing well. So we're talking about HIIT training. So first,
we're going to get into.
Yeah. Can you explain exactly what HIIT training, what it stands for?
Yeah. So HIIT is high intensity interval training, and we're talking about that and the difference of list training, which is low intensity interval. So most folks think that if they got to do HIIT training and they do high intensity, that it means that they've got to, come out of their shoes. They've got to give intensities that they're not used to and their body's ability can't handle. And it's a big misconception because the training actually provides a lot of benefit. It's a big benefit with time, which we know we're all lacking, right? We can't create more time. So if you can get a workout in 10 or 15 minutes and provide the benefits as if you were working out for an hour in your traditional gym setting, that makes a huge difference. So being able to have higher intensity intervals of working out from 20 seconds to a minute and having that equal or greater rest and allowing your body, and it could be done in walking intervals, it could be done in running intervals, dumbbells, kettlebells, you name it. It's just focusing on being able to increase your intensity based off of your ability and then come back to almost a complete rest and repeat that every minute or every 2 minutes. And it just makes such a difference in the results you're going to get.
And is that something, people, I think sometimes associate CrossFit, it's a bit of a niche type of workout that you're doing. It is different than, if you go into an Anytime Fitness or
Yes.
Around the Clock Fitness. It's a different type of workout. Some of these, the high interval training exercises, you mentioned kettlebells and dumbbells. So I'm assuming you can do some of these at home. You don't have to be in a gym to do these.
Not at all. And that's something that, it is important for viewers to understand is that this could be doing air squats or push-ups or burpees in your living room. And in between commercials, it's challenges we give and we gave during, the Rona that we talked about originally, is that what can people do at home? And it's just taking that 10 or 15 minutes to say, okay, well, I'm going to jog in place for 30 seconds or a minute and then rest till my heart rate completely comes down and recovers and I can breathe normally, and then do it again. And how many rounds of that can you do, or how much time do you have, and really take advantage of it? Obviously, we're taking it to the highest level in our facility with CrossFit because we're giving so much variety in there. But it is just like you hit the nail on the head. You could do it anywhere with any movements.
Recommendations wise, Eric, I mean, we're talking about, you're going on a YouTube, you're going on maybe the CrossFit Eng website. You don't want somebody just going into a high intensity training exercise and just going, 200%, because that's when you hurt yourself. What's the recommendation? You go online, find a good workout, or where should people kind of source these?
Yeah, for one, it's self-awareness. So what are your capabilities? Because we don't want to say, hey, I'm going to get into running intervals and I already have an ankle or knee issue, or, I'm going to try all these movements. It's just doing it slow at first and making the intervals short, maybe 15 to 20 seconds, and going slow through the movement the first few times you're doing it to allow yourself to get used to the movement and to make sure you're not going to hurt yourself. And then the other side of it is, as we always talk about when anybody starts a fitness program, is give yourself a 50% effort, that you're just moving and allowing yourself to adapt to the new program that you're in. And that way you can do it more often, so you're going to get more out of it, but then you're able to recover a lot quicker and be able to perform your normal daily activities. Because as we talk about, you go a little too intense, you're walking like a zombie or a pirate, eating Advil like candy. It doesn't motivate anybody or help their health journey at all.
Yeah, and you can't move for about a week. That's Eric Stratman with CrossFit Eng joining us live this morning. We always appreciate Eric's time.